Hello, this is the SFPDA student chapter, SFPDASC, an affiliate program of the West Coast chapter of Parenteraldrugassociation, connecting people, science, and regulation. Today's topic is Vaccinate the Vote. States are told to get ready to receive the vaccine a few days before we vote. I am Nick Kapp, PhD, the SFPDASC academic advisor. We are giving you a series of weekly podcasts that are roughly 5 to 10 minutes long. What we intend to do is to inform and educate a new generation of pharma manufacturing individuals through a discussion of helpful links, stories, and interviews. Help us help you. In the coming weeks, we will be trying out a number of various ways, like a live audience, to inform our listeners of what it takes to work in the pharma manufacturing sphere. If you have any questions, just email me directly at kapp@smccd.edu. All right, so what you may have heard about is that the Centers for Disease Control and Prevention, the CDC, has asked major cities in all 50 states to prepare to distribute a vaccine for the novel coronavirus in about 2 months. What's going on then? The election. CDC Director Robert Redfield sent a letter to the U.S. governors that said that the federal government is teaming up with McKesson. McKesson is a contract provider of pharmaceuticals for the Veterinary Association, so they have all the trucks and everything else in order to do this. McKesson to distribute the novel coronavirus vaccine to local health departments and to doctors' offices. That August letter stated, the CDC urgently requests your assistance in expediting applications for these distribution facilities and, if necessary, asks you to consider waiving requirements that would prevent these facilities from becoming fully operational by November 1st, 2020, 2 days before the election. The requirements that you may be asked to waive in order to expedite vaccine distribution will not compromise the safety or integrity of the products being distributed. That's their statement, that they are going to be delivering the vaccine. The states shouldn't be hindering and the states shouldn't be compromising safety when they do this. This is also interesting because in the last few weeks, over the past couple of weeks, Dr. Anthony Fauci, the country's top infectious disease expert, and Dr. Stephen Hahn, who heads the Food and Drug Administration, have said in interviews with the news organizations that a vaccine may be available for certain groups before clinical trials have been completed, if this data is overwhelmingly positive. And so what we see is we have the Moderna, and some of these studies have about 30,000 students in there, and they're looking for roughly about 200 to roughly about 300 cases. And if we see that the people who've gotten the vaccine get a lot less cases than the people who have gotten the placebo, then if it looks good, they're ready to ship it in November. The CDC plans to lay out technical specifications for 2 candidates described as Vaccine A and Vaccine B, including requirements for shipping, mixing, storage, and administration. The details seem to match the products developed by Pfizer and Moderna. Both of these are RNA vaccines. They're the furthest along to date in the clinical trials. So even over 100 different candidates for this, these are the 2 that have gone the furthest. On August 20th, in fact, Pfizer said that it was on track to seek government review as early as October 2020. And this is something that they have been publishing now for a little while. There were 3 documents that were sent to the public health officials, and I set some links up here, in all states and territories, as well as offices of Department of Public Health of New York, Chicago, Philadelphia, Houston, and San Antonio on August 27th, just a couple of days ago. They outlined detailed scenarios for distributing 2 unidentified vaccine candidates, each requiring freezing below -20. All these places, when these vaccines get shipped, the Moderna vaccine actually has to be frozen at -80 in a deep freezer. The other vaccine actually needs to be put in a freezer. But not only do we have to have the freezers ready for this, but everyone who gets a vaccine needs to get a second dose of that vaccine after 2 weeks at the hospitals, mobile clinics, and other facilities that are targeted for those first recipients. On August 23rd, the AMA, the American Medical Association, called for transparency. The AMA, in their letter, they state the AMA has strongly urged the FDA to work more closely with physician community starting now to develop a plan for further education and transparency surrounding COVID-19 vaccine candidates. So again, the doctors are feeling that they're being left out of this, even though they're sending these letters to the Department of Public Health. The reason why the AMA is saying this is that if we get it wrong now, this can lead to vaccine hesitancy. And so even if we have a good vaccine, if people don't want to take the vaccine, then we're going to be in the same boat that we were before. What we want to do is we want to expedite this, but we want to expedite it and do it safely. So in an August 27th letter from the CDC, obtained by McClatchley, that's a publishing group, and I put the link up here, they asked governors to fast-track permits and licenses for the distribution sites. The normal time required to obtain these permits presents a significant barrier to the success of this urgent public health program. Redfield, who's again the director of the CDC. So what they're looking for is if they think they have a good vaccine, they want to be able to ship this vaccine out to all the different states, and they want the states to expedite their permits and other rules and regulations to allow this vaccine to be essentially going to be given away in those states. All vaccine trials are designed, and that if everything goes well, when you get an answer, this will usually take about 7 months from the time that the trial starts. We haven't even had COVID. It's now September. We haven't really even had COVID in the United States for 7 months, or just at that time. We've been working on this. So with the Operation Warp Speed, we really want to speed this up. And so what we're seeing that we are looking at regulations, we are trying to do 2 studies at once, but what we really want to see is vaccines with a 90% efficacy will give a readout sooner than those with 50% efficacy. We've had about 30,000 people that are getting this vaccine. And you know what? If these vaccines are really good and we're finding this 90% efficacy, then we're going to know that a lot sooner than we would if it was 50 or even lower. So what we have an idea, and what Fauci and a number of these other people have been saying, is that maybe we are getting some of these good results. And so if these numbers look good now, then we can go ahead and move ahead. Tests are being monitored. What we see is that the CDC has weekly calls with state officials. These begun on August 17th. And at the end of August, the CDC completed pilot programs with 5 jurisdictions: California, Florida, North Dakota, Minnesota, and the city of Philadelphia. These will serve as models for operations across the country. Again, what regulations do we need to expedite? Where would the clinics be? How do we store the material, et cetera? Hopefully this has all been done and modeled in those 5 states as well as the city of Philadelphia. What I'd just like to say is that members of the PDA are involved in all aspects of this situation, from manufacturing of vaccines to this regulatory overview. And it would be really nice if the FDA could recognize some of these people and what they're doing. What we're also working from is Johns Hopkins School of Public Health actually set up a framework for COVID-19 vaccine allocation and distribution in the United States. And this was just done this month. And what we see, it's a rough guide as to who will get the vaccine. The Johns Hopkins Bloomberg School of Public Health, this plan is needed for allocating and distributing the limited supply during this period of scarcity. And so when they first come out, they're going to come out, the first batch that they come out with, hopefully in November, is going to be a little bit less than 1 million. And so even though that seems like a lot, we need a lot more, 100 times more of that to cover all of the United States. Plan is needed how to allocate and distribute this limited supply during this first era of scarcity. Which groups should be prioritized to receive the vaccine? Which groups can wait till later? And so these plans are going to promote the common good and public health. There's additional infrastructure that will be needed in order to set these up as well. Not only are we planning for the public good and the public health, but we need to do things like compile immunization registries. And so when children are immunized, there's a registry that goes into, so it's a list that the student have his vaccines. We need to do the same thing for adults. So when an adult goes out or whatever and looks at it, we need to be able to say, hey, this person has been vaccinated. There's a number of different things that we can do, but we need to develop that infrastructure. The other thing that we have to do is that we need to find a bunch of these sub-zero freezers in order to store the vaccine. Now, the CDC in their letter told the health departments, don't go out and buy a whole bunch of freezers. But again, we're going to come on November 1st. We need some place to put this. I put a link up here to the 3 phases of clinical vaccine testing explained. So if you really want to take a look at this, you can take a look at that YouTube. The other thing that we have to have is, again, we need to have safety in clinical trials. Clinical trials for vaccines has been set up for a long time. And so the Vaccine Research Center, the VRC, has a clinical trials core that's devoted to the tenets of good clinical practices, GCP, and is the primary charge of what physicians have of basically doing no harm. The VRC has established multiple safeguards to protect volunteers from physical and social harm. There's a systematic commitment to the ethical principles of clinical studies. We need to study this. We need to make sure that it's safe. We need to really look at it. You can see the website of the VRC in order to get their specifics. But the people who are really looking at the data is basically what we call the Data and Safety Monitoring Board. They have a set of guidelines, and I have a link up here. The DSMB should approve of the vaccine before a EUA, Emergency Use Authorization, is set up. And so the DSMB, basically that has the professionals on it that are going to be looking at this. Now, an EUA can be set up at any time But if we're going to do this right, we need to make sure that the DSMB is able to do their work and that they approve of it. Again, how this happens is we have a number of people on the DSMB, and these include experts in the clinical aspects of the disease and the patient population that are going to be studied. We're going to need one or more biostatisticians so that they can look at this data. We're going to have 30,000 people who got vaccinated. We want to see, when we take a look at this, this is a quadruple blind study, when we take a look at it, did the people who get the vaccine get sick less? Did the people who get the vaccine, unfortunately, they got sick a little bit more? We also will have investigators with expertise in clinical trial conduct and methodology, all of which, when looking at these, could be PDA members. And so I would like to take a look and see if there's anyone here who is a PDA member. What we're taking a look at is we have this intersection between, is it politics or is it science? It's a little fishy that these things that we're telling everyone to get ready for delivery of the vaccine right on November 1st when the election is on November 3rd. What we really got to see, and I'm going back here, that Data Safety Monitoring Board needs to be absolutely free to make that recommendation. Political appointee in the FDA and Health and Human Services could possibly force through an emergency use authorization. However, if that Data and Safety Monitoring Board looks at this, the Moderna and the GlaxoSmithKline, these are new vaccines, but if the data comes out and it's as promising as they are, and it's really good, then by all means, I think the Data and Safety Monitoring Board should say, go ahead and approve this. But again, if they have a hesitancy, if they should wait a little bit longer, I think we should really listen to that. What we're looking at, we have this intersection between politics and science. Thanks for tuning in. This is Kapp Blogs at SFPDASC. Thanks for listening.